As a general rule, when we have knee pain, it might be because of the physical activities we're involved in. And if that knee pain occurs during exercise, could be because of the physicality of the strenuous activity we're involved in. If that pain subsides upon the when the activity is stopped, then it's likely to be something temporary, and it's likely to subside over time. If the pain continues at rest, then it is likely to be something more serious, and it should be looked into. If the pain doesn't improve with rest, regular anti-inflammatories, and a change in habits, then perhaps it's something to really look into, especially if the pain disturbs a night's sleep. So, of course, as we grow in age, as we get older, it is expected to have an onset of degenerative changes, which is again most expected in more active people. So if the pain persists at rest, and it is not influenced by the level of activities, and actually it's worsened by activity, then of course it should be looked into. It depends on the level of depends on the age group. So if it occurs in the younger population, both male and female, and it's following activities or traumatic injuries, then it requires attention. If the pain subsides upon rest following activity, then it's likely to be something temporary. If the pain is associated with catching or locking or restriction of movement, associated with swelling, associated with throbbing following these activities, it is likely that a significant injury has occurred, and specialist attention is required. For populations slightly older, for middle-age group, it is expected that we develop degenerative changes during our lifetime, and these changes could be brought forward by certain types of activities. And again, if the pain persists at rest and is worsened by certain activities, it means that it is some background problem which needs to be looked into before continuing with activities. Of course, especially for someone who's not used to high intensity activities. So for someone who is decided to change abruptly their ways and do some changes in their physicality, say from couch to 5K, which is very popular these days, without the preparation, without proper warm-up, without paying attention to the footwear and the environment, of course this can lead to knee pain. But for those who are used to physical activities, who are used to running, who are used to going outdoors or spending time in the gym, and are developing knee pain following these activities, then it is most likely something more serious, which can be can become worse with time and activity, and the advice is to seek medical attention. As a general rule for at all types of population at all ages, if we decide to undertake a specific type of activity, let's say preparation for a marathon or preparation for a high intensity activity, perhaps a checkup with a specialist is advisable. If the pain occurs following a certain exercise, a certain activity, and upon the activity being stopped, the pain it's getting better by itself through rest, then pain it is likely to be activity related. However, if the pain continues whilst resting, even if you take a break from that specific activity for a few days, and the pain continues to exist, to persist, then it is likely to continue if left untreated. It is not uncommon that we, as humans, develop, as we grow old, we develop degenerative changes, which are normal. And whilst we are used to a certain type of activity, or being active, even for regular gym goers or runners, they're used to a certain level of physical activity. But one day a certain trivial movement has brought certain unspecific pain inside of the knee joint, and if is left untreated, it can progress and can lead to symptoms which are stopping the ability and capability to continue with those activities. So therefore, it should be looked into. That person who has that type of pain should really address it. Should go and see a specialist about the knee pain before continuing with their activity.